start now. Bismillahirrahmanirrahim. Today we are going to discuss about the complications of diabetes. Yes. What we have discussed? There are two types of diabetes. What is diabetes? What is diabetes? So you know something about diabetes. So the initial slides are all those basics. It is a group of metabolic disorder sharing the common underlying feature of hyperglycemia. Okay? Due to absolute or relative deficiency of insulin, and clinically it is diagnosed by polyuria. Polyuria means increased urine output. Polydipsia, thirst. Polyphagia, increase hunger. See, there are two things. One is we are telling hyperglycemia. Hyperglycemia means increase glucose in the blood. On the other side, in diabetes there is hyperphagia. That means we want more glucose. How do you correlate these two things?
Hyperphagia.
Polyphagia. Polyphagia means yeah, very good. I want this answer. Because the glucose is extracellular, whereas in diabetes there is intracellular hypoglycemia. There is decreased glucose inside the cell, and because of this decreased glucose inside the cell, it will trigger this hypopolyphagia. Okay, criteria, either one of these should be there. Random blood glucose of more than 200 with signs and symptoms, fasting of 126, abnormal O, what is OGTT? Just only. OGTT stands for oral glucose tolerance test. Oral glucose tolerance test means it is the behavior of glucose or behavior of insulin. For example, if you take any food, or if you take lunch now, after half an hour, the glucose level slowly starts rising. After 1 hour, it will rise to peak. After 1.5 and 2 hours, it will again comes to normal in a normal person. Whereas if he is a diabetes, what will happen if you take food and there is no insulin, the glucose will start rising, and after 2 hours, still it will be increased. It will not come back to normal. So that behavior of glucose is checked by this glucose tolerance test. Okay? These are the few epidemiology things. Diabetes mellitus is sweet urine, 3% of world population. Incidence is increasing. You can have the latest update also. Online you can get. Okay, this slide shows what is the action of hormones on the glucose. In this, if you see only insulin, the action of insulin on glucose is it will decrease, whereas all other hormones it will increase the blood glucose level. Now you have to see the action of insulin. It is mainly on 3 organs. First is adipose tissue. Second is skeletal muscle, third is liver. In fact, in adipose tissue, what is its action?
Lipogenesis.
Yes, lipogenesis, decreased lipolysis, and increased glucose uptake. In muscle,
Increase the absorbency towards the muscle to increase uptake.
yeah. So for that reason, if you see diabetic patient with complications, initially he will be very fat. After 10 or 15 years, the same person will be very thin because of this problem. Okay? Muscle. And third is the liver. What is gluconeogenesis?
Formation of glucose.
Formation of glucose by non-carbohydrate. Yeah, very good. This one. Okay, so all this is, I think, biochemistry we have discussed this. Classification, it is divided into 2 types, primary and secondary. Primary is type 1 and type 2. Secondary means causes which will lead to diabetes, like inflammation, hemochromatosis, infection, drugs, all these, you have some cause which is affecting the pancreas. Because of that, there is diabetes. Whereas we are going to discuss about the above two, type 1 and type 2. Type 1 is insulin dependent, type 2 is NIDDM, non-insulin dependent. Insulin dependent means there is no insulin for this. There is no insulin for this patient.
Yes.
So there is absolute deficiency of insulin. Whereas NIDDM, it is relative. That means the tissue is not responding to insulin. Yes? No, it's not always, but it is absolute deficiency. The patient, he needs insulin. Okay. Absolute deficiency of insulin secretion caused by autoimmune destruction of pancreatic cells. HLA, approximately it is only 10%, whereas the majority will be the type 2. Okay? HLA, this is human leukocyte antigen. I think you have discussed this. Yeah. You just remember the names of this. Okay, these are the differences between type 1 and type 2. Okay. Type 1 is less common, type 2 is more common. Children are affected in type 1, whereas adults are affected in type 2. This is insulin dependent. The second one is non-insulin dependent. This has acute metabolic What do you mean by metabolic complications? Yeah, very good. Ketoacidosis, coma, all these are common in type 1. Whereas what is common in type 2 is vascular complications. Those we are going to see. Autoimmunity, most of the time it is present here, then it is not present. Here there is inflammation, there it is atrophy and amyloid. Again, this is the pathogenesis of type 1. Genetic predisposition leading to environment and autoimmunity. You can see here, environment, viral infection, toxic chemicals also plays a role. Autoimmunity, all this will lead to formation of islet cell antibodies, beta cell destruction and insulin release. This is the pathogenesis of type 2. Genetic predisposition, environment, again all this derangement will lead to hyperglycemia. Why I am going fast means all this I think you have discussed, but the most important, our lecture starts from here. Okay? Complications. Okay. Now comes the complications. There are two types of complications. One is early, second is late. Early means sudden. So early complication, it is more common in type 1. And late complications, more common in type 2. So early complications, just now we have discussed metabolic complications like ketoacidosis, coma, lactic acidosis. This is common in type 1. These are the early complications. Whereas late complication, inflammation, insulinitis. Insulinitis is inflammation of the islets. And amyloidosis, deposition of amyloid. Macroangiopathy, microangiopathy. These are the late complications of diabetes. In this lecture, we are going to discuss about how this complication occurs. This is the main objective of your lecture. Yes?
Insulitis.
Insulitis, you know?
Inflammation of what?
Inflammation of the islets. Islets, insulin secreted by
Beta cells.
Of?
Beta cells of the
islets of the. So inflammation of those is called insulitis. Amyloidosis. It is, what is amyloid? It is protein deposition which occurs in diabetes. This we will discuss. These are the complications which you will see. Microangiopathy, this is just a figure. And after discussing the pathogenesis of this complication, you yourself can write all these things. Now it looks very complicated, but you can easily write. Okay? In a nutshell, all organs, almost all organs of the body, they get affected in diabetes. Like brain, you will have microangiopathy, cerebrovascular infarct, hemorrhage. hypertension, myocardial infarct, atherosclerosis, nephrosclerosis, peripheral neuropathy, gastroparesis, islet cell loss, all these are gangrene. These two slides, I think this slide is the most important slide of all the lecture. Okay? And there is no excuse if you don't write this, if it is us. Okay? Actually, we know these are the complications. For example, type 1, there are some complications, type 2, but the most important is related to type 2 complication, because type 2 diabetes is most common. So the complication will be more common in type 2. You will see many patients who with complaints of burning of the hands and feet, diabetic patients, or they have some vision problem, or they have some kidney problem. Okay? Many patients you will see, but less patient you will see he is going into coma or ketoacidosis. Okay? So you should know how this neuropathy or nephropathy or glomerulosclerosis is happening. So these are the three things in the pathogenesis: first, second, and third. First one is the non-enzymatic glycosylation. That means glucose precursor attached to protein. What do you mean by this? Carbohydrates? Yeah, very good. Precursor means? Any substance before that. So these glucose precursors, they get attached to the protein, and during this reaction, there will be formation of early glycation products. And these early glycation products will convert into advanced glycation end products. So what are these ages? Advanced glycation end products, what they will have? They have cross-links between polypeptides. You know, the cell have proteins in the wall of the cell. Cell wall has proteins, there is extracellular proteins. Okay? These cross-links, sometimes what will happen, because of these cross-links, if it is a normal cross-links, the cells, they will have normal function. You know, whenever proteins are found, they should be released and it should function normally. Sometimes there are abnormal proteins, or the proteins are forming but they release and their function is not proper. So what will happen? These proteins, they get tagged. You know, tagged. What do you use? Instead of properly functioning, they get accumulated inside the cell, or they get accumulated outside the cell, extracellular matrix. Yes?
Is this related to amylase?
Amyloid, amyloid is also in this only. Okay? So because of this, the proteins, they don't get filtered and they start accumulating in the extracellular matrix, in the cell wall. Okay, one is this. Second thing is, these ages, advanced glycation end products, they will increase cytokines. What is cytokine? Inflammation. Inflammatory. Mediators of inflammation we have discussed. So this is a mediator of inflammation. So what it will cause? It will attract the inflammatory cells. Cytokine is a inflammatory mediator. It is pro-inflammatory. So it will attract inflammatory cells. What is ROS? Reactive oxygen species. So what is the function of ROS? It destroys the cell. In a nutshell, oxidative stress, or it destroys the cell. So these are the three things which advanced glycation end products will do. What? First, it will accumulate the proteins. Second thing, it is cytokines. Because of cytokines, there will be inflammatory reaction. And third is reactive oxygen, oxidative stress, which will destroy the cell. This is one pathogenesis. This is one mechanism. Second thing is activation of protein kinase. This protein kinase, again, it has three functions. One is pro-angiogenic. What is angio? Angio means blood vessel. Pro-angiogenic means? Angiogenic means formation of blood vessels. Pro-angio means it forms. Okay? it forms new blood vessels. How it forms these new blood vessels? By activation of VEGF, vascular endothelial growth factor. Okay? Second is pro-fibrogenic. What is fibrosis? It is, fibrous tissue, it is a connective tissue, you can say anything. Pro-fibrogenic means it will increase formation of connective tissue, that is fibrosis. Okay? And this it will do through TGF. What is TGF? Not, it is transforming growth factor. And third is pro-inflammatory cytokines. Again, it is same. Pro-inflammatory. So, one activation of protein kinase, it will cause pro-angiogenic effect. That means new blood vessels forms. I will give you an example. A patient diabetic patient, after 5 or 6 years, he will complain of vision problem. Okay? And once he went to the ophthalmologist, and ophthalmologist when he will see some spots, red spots. Okay? Those red spots is nothing but formation of new blood vessels. Okay? That is called diabetic retinopathy. Inside the retina, he will have formation of new blood vessels. I think I have that photograph also, I will show you. So this is the pathogenesis for that vision problem, retinopathy. Pro-fibrogenic, we will discuss. I have photograph. Pro-inflammatory cytokines, it is nothing but inflammation. Okay, third one. Okay, there is difference between these two, first and second. You know, all tissues, they need insulin, whereas which one does not require insulin?
Brain.
Yeah, very good. Brain. Okay? Brain doesn't need insulin. So, brain will have, always it will have glucose. So, brain should be normal always. But in diabetes, there is some problem in brain also. What is that problem? Yeah, very good. Hemorrhage is there. Why? See, normal person, insulin is required in other tissues. Okay, except brain. So brain, it will take without insulin glucose. But in a normal person, brain will take insulin glucose up to a certain limit. If it keep on taking glucose, what will happen? There will be hyperglycemia inside the cell. Okay. So this is the pathogenesis for hyperglycemia inside the brain. If the brain keep on taking glucose, there will be hyperglycemia, and what will happen? It will convert into sorbitol. With disturbance in polyol pathway, glucose will convert into sorbitol, sorbitol will convert into fructose. Why? Because of this excess glucose. Okay? Brain is taking glucose because in diabetic patient, there is no control, it keep on taking glucose. So this glucose, after certain limit, it will convert into sorbitol, sorbitol will convert into fructose, and this fructose is responsible for cell injury and oxidative stress. Okay, just remember this much.
Activation of protein kinase C by what?
Activation of, this I think we have to.
By that?
Yeah. In diabetic patients, because of hypoglycemia, this protein kinase C activates. Okay? Means. Yeah? Treated means you have to just treat the diabetes. If you just treat the diabetes, everything becomes under control. Okay? So all these three, just remember, advanced glycation in products. Second thing is activation of protein kinase C, and third is hyperglycemia. These are the three pathogenic mechanisms. Is it clear? Now we will apply in the organs how these get involved. This is one more diagram for, I told you, for diabetic coma also there is some pathogenesis. What is that? Insulin deficiency or insulin resistance. It will lead to decreased tissue glucose. So whenever there is decreased glucose, what will happen in adipose tissue? Yeah, lipolysis, increased lipolysis. In skeletal muscles? Catabolism. So it will lead to lactic.
Lactic acid, English
Yeah,
lactic
it
acid.
will lead to lactic acidosis. And in liver, yeah, there is no gluconeogenesis and they will be So all this will lead to polyphagia, this will lead to ketoacidosis and hyperglycemia directly. It will affect the kidney, and in kidney there will be filtration up till 180. After that, it is secreted in the urine. So there will be glycosuria that will lead to volume depletion, polydipsia. All this mechanism will lead to diabetic coma. So in pathogenesis for type 1 you have to mention these things, how it is involved, and in type 2 you have three things: advanced glycation end products, activation of protein kinase C, and third is in hyperglycemia, intracellular hyperglycemia. Is it clear?
Yes.
Now you start. You should tell what will happen in pancreas. Reduction in number and size of islets. Okay, just read this. Second thing is leukocyte infiltration. How this leukocyte is coming? Yeah, very good. It is from cytokines, pro-inflammatory cytokines. Because of that, there is leukocyte infiltration. This is the leukocyte. All these dots. Okay? All these dots are leukocyte infiltration. Amyloid replacement. From where this amyloid is coming? Through advanced glycation products. I told you there is problem in the function of the proteins. The protein starts accumulating. Amyloid is nothing but protein. So this, type 2. So leukocyte infiltration. One more thing, leukocyte infiltration. I told you there is autoantibody production in type 1 or type 2? Type 1. Autoantibodies, they are involved in type 1. So autoantibodies, what they will do? They will destroy. They will destroy the islets. During this destruction, whenever any cell is destroyed, the role of inflammation starts. So there will be accumulation of inflammatory cells. All this pink. Okay, one more thing. This pink material, can you see? All this pinkish material is amyloid, which is seen in type 2. Very good. If you do Congo red stain, you can see clearly. Okay, what you are seeing here? What is macrovascular disease? What is microvascular? Macro means blood vessels, large blood vessels. Micro means small. So large blood vessels, what you will see? Large blood vessels, example is aorta and other great arteries. All great arteries they are macro, and micro arterioles. Yeah. Okay, so now we are going to discuss macrovascular, like aorta and the major arteries. Okay, so what is happening there? You are seeing this thing. The same diagram you will see in complications of hypertension or ischemic heart disease or ischemic disease. You will see again the same diagram. So, but in diabetes, what you are seeing? What do you mean by fatty dots? Yeah, you will see vessel wall is there. You are seeing fatty dots means accumulation of fat. What is that fat? It is LDL. Most common is LDL. LDL stands for low density lipoprotein. This I want to stress because it is not just fat, it is lipoprotein. And protein is again deposited because of which mechanism? Advanced glycation end product. So this advanced glycation end products, I told you, if this blood vessel is normal, it will be white, there is no fatty dots. Okay. Because of this problem, this cross-linking problem, the LDL lipoproteins, these molecules, they get trapped in that and they get